And only on CBS Colorado tonight, from depression to anxiety and everything in between. Health experts around the country say our kids are in a mental health crisis. Parents are heeding the warning and trying to get help for their children, but they can't.
A group of behavioral health providers is sharing their struggles providing care. More than a dozen providers have come forward claiming Anthem Blue Cross Blue Shield insurance is creating hurdles, keeping them from expanding their services. And this is a widespread problem. A quarter of all kids 5 and older say they have at least 8 days of poor mental health every month. And 1.6 million teenagers 16 and older report declining mental health.
CBS 4 investigator Karen Morfitt has been working on this story for weeks now for you. And Karen, you sat down with providers and Anthem members who say these issues are really causing massive wait lists all across the state.
Yeah, Karen, and that's hard to hear, right? But they're pointing specifically to Anthem because they are one of the largest providers here in the state. With so many of the people they are putting on wait lists are their members. When thousands of Coloradans lose Medicaid next month, they also worry the problem will only get worse.
Families in Colorado want help.
I'm so desperate to find care for her.
Adults and their children are struggling with mental health, but can't get support.
I shouldn't have to wait until my kid is in complete crisis mode to be able to unlock care for them based upon my insurance.
These mothers are willing to share their experience, but providers we spoke with say their wait lists grow every day.
We currently have over 120 kids on our wait list waiting for services, some of whom have been on that wait list close to a year.
Blair Skinner is the director of Early Childhood Wellness Place in Broomfield. She says attempts to meet the need have stalled, largely due to issues with the Anthem insurance company.
We tell clients who have Anthem, you're going to be waiting 2 to 3 times as long as everybody else.
In Centennial, Kelly Bianucci, the operating chair for the Child and Family Therapy Center of Denver, is dealing with the same issues and same company.
We started capping our Anthem wait list at 80.
Bianucci and Skinner want to add new clinicians and help more people. But Anthem, they say, is either slow to approve or denying their requests altogether.
We've had 4 clinicians join our team since last summer and have not been able to get a single one added to our Anthem contract.
They're also limited by Anthem on what staff they can use.
I have the 3, licensure candidate professionals who are fantastic, and they will not allow anybody unless they are fully licensed to see their clients.
Skinner compared those candidates to residents in a hospital. In a statement, Anthem says it is essential to confirm each provider is licensed and credentialed to ensure our members receive high-quality, effective care. This process can take time, and we are working to complete credentialing of new providers as quickly as possible.
It's very admirable to say, right, all of our providers are fully licensed and we only want the best for our clients, but that really limits the number of providers.
Anthem says it's expanded its network to include nearly 10,000 behavioral health professionals. But more than a dozen providers and patients we've heard from say finding in-network care is nearly impossible.
I've literally called dozens of providers, so both larger agencies and individual therapists, trying to find a provider to see her.
While Bianucci says Anthem may list a number of providers for their members without openings, it's a ghost network.
If there's truly enough providers out there, how can we put members in touch with them? We would love to send them directly to those options.
Anthem says it contacts providers monthly, and it's the provider's responsibility to update whether they can accept new patients. Colorado's Division of Insurance is tasked with making sure networks are adequate. Kara Cheevers, Director of Behavioral Health Programs, says their latest review found many of the same issues around networks and credentialing.
When we are talking widely about the need for mental and behavioral health, does that prompt you guys to want to, put it on the top of the to-do list?
If we are receiving complaints, short answer is yes. We know that there are some serious problems in this space, which is why we're currently looking into them.
Requiring insurance companies to allow the use of pre-licensure candidates, she said, is also worth considering.
I think we as a state, spearheaded by Governor Polis, are really thinking about creative ways that we can expand the provider base. And in terms of the pre-licensure work, I think that is one really interesting and potential creative solution.
Representative Matt Soper, who sits on the Health and Insurance Committee in the state legislature, says while they've tried to address credentialing delays in the past, it might be time to revisit the problem.
It's really going back and taking a deeper dive and saying, what were we unable to do last year with the legislation? What do we need to tweak? Because obviously we didn't get something right.
Providers say it's great to hear, but change needs to happen soon before the public health emergency that allowed for more people to qualify for Medicaid expires.
The end of the public health emergency is a ticking time bomb for the mental health crisis. You're going to have up to 20 million Americans and 500,000 Coloradans coming off Medicaid and onto a commercial insurance network. Those commercial insurance networks are already stretched thin, so the explosion of unmet mental health needs once this happens will be catastrophic.
Now, Anthem told us since last June, 90% of credentialing has been completed in less than 30 days. When asked if they had any data to show that, we didn't hear back. Providers also say Anthem reimburses at one, if not the lowest rate, and many claim to not have had an increase in nearly a decade. Anthem says reimbursement rates are confidential, so they could not discuss them with us. The Division of Insurance wants to hear from these providers directly. Karen?
Karen, this is obviously really frustrating and confusing for families. So what can families do, if anything?
Well, you know, the Division of Insurance, we spoke with them for quite some time and tried to get to the bottom of this, tried to get some answers for consumers. They say that they have more rights than they know. And actually, if you, they have a 7-day requirement. So if you cannot get into a provider in that time, you are actually allowed to go out of network at an in-network rate, and they have to honor that.
But you have to go after them, you know.
Yeah.
You have to follow up to get your money back.
Exactly.
Right?
So there are a lot of things that still need to be fixed in this insurance world.
All right. Karen, thank you so much.